beginning with our posture assessment, I do want to just have a look and see if there's structural abnormalities. Now, I know you said you've been experiencing some back pain. Okay. So let me have a look with my light here and see if I can see signs of misalignment. So typically, I can kind of step back and have a look and see at the shoulders as well as at the spine and alignment of the head if there's anything that appears not quite as symmetrical. So I'm not seeing anything too bad. Now I do see just a little bit of postural corrections that can be done, but that's an easy fix. So having a look as well. At the head and neck posture. Now is that pain kind of radiated here to the, isolated here to that mid back?
Yes.
Okay, so I do see a little bit of distension here along the top thoracic spine for sure. Follow along the scapula. So you let me know as I go if any of this is particularly uncomfortable, if you feel any pain. I'm going to go ahead and palpate along the spine. So I'm just going to right here along that top thoracic spine and see if I feel any abnormal nodules, any kind of bumps or lumps that feel abnormal to the anatomy. So just looking to see if it's just kind of general swelling or if there is a bigger cause for concern. So as I palpate here along the spine directly, is that uncomfortable at all? Painful?
No.
No. Okay. That's good. Shoulders as well. Any pain or discomfort here?
No.
Okay, so I'm going to assess for some mobility here. So I'm going to start just have a look at your neck. So I'm going to start by just moving your head slightly. So you let me know if any of this hurts. I'm looking for abnormal rigidity of the head and neck. Just go ahead and come all the way forward for me and then all the way back. So all of that feel okay? I'm going to bring this shoulder here back just like that, and then we'll rest the elbow. Much better. Same with this side. So what that does is square off the shoulder versus like a rounded, slumpy posture here. So what I'm going to do is let's bring both here so elbows are about at your pocket. I'm going to have you breathe in Very good. So that probably feels uncomfortable. So this is more of a kind of upward posture. Now, I wouldn't say this is a natural posture. Obviously, you're not sitting like this just at all times, but that does certainly square off the shoulder. So if I adjust you there. Very good. Okay. Well, that certainly seems just a touch better. Just checking at the joint to see if there's any bigger concerns here. Okay. So you can go ahead and relax back to your natural position. Just gonna have a look here. Any pain at the shoulder here?
No.
No. Head and neck alignment actually is very good. Let's perform some auscultation. So I have a stethoscope and I'm going to just listen. So it just allows me to listen for anything internal that could be causing your discomfort. So typically we see like a musculature issue or a venous issue where your veins are maybe causing some distension. Not hearing any of that though, which is very good news. So if this is just a physical manifestation, whereas the pain is more external and there are no issues internally, then that can be mitigated with different therapies like physical therapy, occupational therapy. They can work with you on your posture. So just listening. Listening at the spine here. I'm just going to percuss That sounds okay. So let me go ahead and measure for symmetry here, checking to see if is in fact a misalignment or any signs of injury that could have occurred. Sometimes we do injure ourselves and we're just not really aware of it until a couple days later. So a lot of the time, the pain and kind of discomfort or rigidity of the muscles doesn't start to manifest physically until the swelling has set in. So say, for example, you fell or you maybe hit your head. A lot of the times we think, oh, well, I feel fine. And then maybe a couple of days later, you start to feel symptoms of a headache or even loss of consciousness. I've had specifically my athletic patients who have injured themselves, playing football, playing basketball, and they don't realize how severe the injury is until a couple days to a week later when they're like, oh, okay, I really am not feeling well. So I'm just checking to see if there's any swelling, particularly swelling that is asymmetrical. So if one side appears to be abnormally aligned, then could be looking at just a need for a simple realignment, in which case I would send you to a chiropractor. Now, have you ever visited a chiropractor?
Yes.
You have, okay. When is the last time you had an adjustment?
About a year.
Okay, so it's been a little while. Prior to that last adjustment, were you seeing your chiropractor frequently or just?
No.
No.
I had an accident which
I see.
led me to the chiropractor.
I see. Okay. And did that accident involve like your back pain, shoulders?
Yes.
It did. Okay. So it could very well be just kind of a late response. So if you haven't seen your chiropractor in a while, so a year is a little bit long, it could be that you're just due for a realignment. And with that, they can assess for any damage that may have occurred over the last 12 months. Sometimes some of that swelling will just come back, or your vertebrae in your back will just need a little bit more treatment, and that is very common. So even if you see a chiropractor regularly, a lot of people go either on like a monthly or 6-week basis, and then you take a break for a long time. Your joints have essentially had time to kind of contract into their natural state, which for some people is inflamed. So visiting a chiropractor again can kind of get you back to square one. So vertebrae themselves do appear evenly spaced. I'm not noting any gapping here. Okay, so that's good. So I'm going to check for bone conduction. Now, essentially what that means is I'm going to produce a vibration sensation at the joint. Can you feel that? Okay. Feel it here?
Yes.
Yes, okay. Feel that along the thoracic spine there?
Yes.
So just checking to see if there's any differences from one side to the other. So if this feels any different from this side,
This feels more intense.
does it on this side?
Mm-hmm.
Okay. And is that the same at the elbow?
It feels less intense on the
Less intense on the elbow, okay. Mid-back, any differences there?
less intense.
Less intense. So definitely here getting some hypersensitivity.
More intense.
More intense. Let me see if I can feel any This is right in between the clavicle and the scapula. You ever use any topical therapy at home, like hot or ice, heat or ice?
Not recently.
Not recently. Okay. Is the discomfort ever so bad that you feel like you have to take like an over-the-counter pain medication, Tylenol, ibuprofen?
No.
So do you see just a slight lean there? So typically indicates a weakening of the muscle on the side that you're leaning towards. So I'm going to test to see, I know obviously you have on a shirt, but can you feel this here? You feel that it's pretty sharp? Any difference in the sharpness as I go down your arm?
Yeah, less sharp.
Less sharp down as I go further down? Okay. Is that the same on this side, that it gets less sharp?
No, it's more sharp.
It's more sharp. Okay. So you're having some hypersensitivity on this side for sure. And this here compared to this, is it the same or different?
Same.
The same. Anything? So if I test, just gonna move your hair out of the way for just a second. Any difference in sensation on this side? Near this side?
Yes,
More on this side. Okay. I'm going to do a little bit of pressure point therapy. Now I have an acupressure tool here. This is going to allow me to apply specific pressure to these smaller, more intricate tendinous areas. So just I'm going to refer you to a couple different specialists. Now, I definitely want you to see a physical therapist. They can help you with some physio help. They will do some muscle movements with you. They will do a deeper assessment of your posture, as well as your mobility assessment. So they're going to have you do things like raise your arms up and down, move them around, just to assess for differences between the two sides. So I am definitely noticing a difference on this side. A lot less rigid over here, so you've got some tightness in that shoulder for sure. Where does that hypersensitivity extend to? So down here it's not quite as much?
yes, it's quite as
Not quite as much. And how far up your neck would you say it goes?
yeah, right, so about here.
About there. Okay. You might even benefit from seeing an acupressure specialist. They can also perform acupuncture on you or some dry needling to really encourage healing in this area. So they have these little microscopic looking needles that kind of go into your skin topically, and they just sit on the surface, and it really just allows for like adequate blood flow to the area, which in turn encourages healing. So that's something that I would definitely consider. I oftentimes like to assess these issues from just more than one angle. So I do think you are due for a realignment with your chiropractor for sure, specifically for that kind of misalignment of the shoulder here. But I also think some holistic therapy would be beneficial. So if you're open to it, I do have a couple Eastern medicine specialist that I can refer you to. I like to try to mitigate these problems more holistically before we refer you to any sort of medication, specifically opioid medication or anything like that. I think a lot of this can be treated via chiropractor therapy, physical therapy, maybe even seeing an occupational therapist. Occupational therapist will go over different things with you, not teaching you, but showing you how to, move yourself in a certain way to avoid further injury. No loss of sensation overall. You can feel me touching you, correct?
Yes.
Along your scalp ball here, you feel me touching you?
Yes.
Okay. Okay. So nothing is dislocated. No major sign of injury, but I do think this is just secondary to your accident that you had previously. Okay. So what I'm going to do, India, is refer you to a couple different specialists. I would like you to see the chiropractor first if possible. If you're more comfortable seeing the one that treated you previously, that's okay. If not, I do have a couple in your area that I can refer you to. Do you have access to your patient portal?
Yes.
Okay, so I'm going to go ahead and put those referrals in electronically, if that's okay with you. Good. Okay, so they will be categorized. You'll see a list of chiropractors, you'll see a list of physical therapists, occupational therapists, etc. Please do visit the chiropractor soon, if possible. After you have that realignment, I would like to see you back to see if there are any changes, either good or bad. And then we can kind of go from there. And I would guess the second step is going to be getting you into some PT as well as to some acupressure specialists, okay? All right, so I do think we have at least a plan to find you a solution for the pain. Now, in the meantime, keep a couple things in mind. Try to be mindful of your posture. I don't want you to overextend, but do try to remain upright. Remember to breathe in, pull your shoulders back when you can. Try not to slouch. Sit in a chair that has supportive back, specifically lumbar support. Stay hydrated, of course. Water intake can affect this as well. And if you notice any abnormal swelling, specifically like lumps or anything protruding in certain areas, definitely come back before your next appointment, okay? Okay. All right, well, thank you so much for coming in. I am going to head to my office to get those referrals put in for you, and then as soon as you can, go ahead and have a look at that, and we will begin with your treatment, okay?
Thank you.
All right, thank you so much. I hope we get to get you feeling better soon.